I'm Mabel Jong. Thanks for watching. And here in the studio, we have Dr. Emad Rizk, who is now President and CEO of Accretive Health. Dr. Rizk, it's so great to see you.
It's wonderful to see you, Mabel. It's always wonderful.
Yes, for me as well. And you're on a new adventure. You've begun a post at Accretive Health. Tell me about the new job.
Sure. Well, as you remember, my past job, I was focused on helping payers increase their efficiencies through various activities. Right now, I've moved over to the provider side, which is very dear to my heart.
Like going home, almost.
It's kind of like coming back, and especially during this time where providers are undergoing a great deal of change, and the movement from fee-for-service to value-based payments. That is a very significant move from them, and coming from the payer side, I feel that I can help them. So Accretive is an organization that helps these very large health systems improve their revenue cycle, really through lowering their cost, improving their revenue, and preparing them for these value-based payments. So as these health systems more and more come under a lot of pressure, and they start to develop payer-like activities, I feel I'm in a unique position to help Accretive sort of help our customers and our health system and provider customers.
Well, you bring valuable knowledge having been on both sides now, haven't you? What was it about the foundation of Accretive that drew you to that particular organization?
The value proposition. Prior to coming here, I did some due diligence. Most importantly, I wanted to find out that the value proposition to our customers is high. That we are able to reduce the cost. We are able to lift the revenue and prepare them for these difficult times coming over the next 3 to 5 years. And as I digged into the data, I saw that Accretive was able to achieve 20 to 30% reduction in cost to manage of revenue cycle, which is significant for, large. Well, they do it by a lot of it's a combination of processes and services and technology, proprietary technologies, the combination of technology and services. And we actually do not go in and help organizations remove any of their current technology. We just overlay our processes, and we have very strong, rigorous operational processes. We have shared service centers, and we have proprietary technology that helps them. I think in the next 3 to 4 years, to move away a little bit from Accretive, health systems are under a significant amount of pressure. They really need to bring their costs down over the next 3 to 4 years and build this capability of risk. Bundles and episodes are very complex to navigate.
And are you finding, now that you are back on that side of the provider, are you finding that you have clear answers on what needs to be done? That you could see that switching to an episodic case scenario makes more sense, and how do we go about getting to that?
Well, the value-based component of payment is actually the right thing to do in healthcare. I think for all too long we paid for volume and not as much value. So I absolutely believe this is the right thing to do. However, the preparation to go from volume to value is complex. And no two bundles are created equal, and no two episodes are created equal. And if you keep in mind that the hospital systems are used to very linear interactions in a fee-for-service world, now they have to coordinate the care, now they have to do clinical integration, and also they have to integrate their administrative and financial infrastructure. And it's a lot for providers to take. And in the backdrop of all this is they're also acquiring other hospitals, and they're consolidating, and they're acquiring physicians. So a lot of activity that's on their plate.
Sure. What was the panel that you participated in today?
It was exactly that. It was the movement from how do you balance both? Because we're not going to make a switch from fee-for-service directly into value-based. We will coexist in both. There are some folks that use the analogy that you have 2 feet on 2 separate boats that are going in separate directions, but I don't think so. I think as you build capabilities for this value-based payment, there'll be a tipping point that you kind of move over and start managing your systems and your infrastructure in that way. So we were talking about the difficulty around clinical integration, which is one piece, administrative integration and financial integration, how you engage physicians as you start to acquire them, how do you create standardized processes in these large health systems that are consolidating. So as you know, when you consolidate and acquire separate hospitals, they all come with their own systems and their own processes. So organizations like us can create a standardized layer across of them so they could get to value and to their synergy play much better.
And what is your overall message you want to leave with attendees? And were you encouraged by some of the things that you heard from your colleagues?
I was. I mean, I think we are all learning. And I started to see two to three things occurring that's interesting. I'm seeing administrators and physicians and financial acumen folks coming together. So it's this multidisciplinary approach to solving our healthcare needs. I enjoy that. We, on our panel, we had a finance person and we had two physicians and a lawyer. So across the whole spectrum, and yet we're all focused on what that outcome needs to be. The second thing is folks are looking for help. They know that they can't solve all the problems from soup to nuts. So you start to see that there's an openness to partnering, an openness to outsourcing, an openness to get as much expertise as possible just to get to the outcome that you want. Where in the past we all stayed in our silos. We sort of wanted to stay, not talk to other disciplines, and we wanted to do everything. Now I see people are much more open.
And collaborating.
And much more collaborating than I ever. I think 2-3 years ago we were talking about the fact that collaboration is getting better between providers and physicians, hospitals and payers, and I'm seeing that actually in the market play out right now.
Okay, well, Dr. Rizk, we're going to have to leave it right there,
Sure.
but it's great to check in with you.
Always, it's a pleasure.
And
Thank you
good
so
luck
much.
with the new adventure.
Thank you so much. I appreciate it.
See you, thank you.
Thank you.
And I'm Mabel Jong. Thanks for watching.